Hello, everyone, and welcome to Timing is Everything, a program of Care Dimensions. Oh, don't change that dial. You are in the right spot. My name is Lynn Scarmus, and I'm the Vice President of Business Development here at Care Dimensions. And for those of you who tuned in, I know you expect to see Mary Crow, who hosts this program. Well, don't worry. Mary is here today with us, but not as a host, but as a guest. Yes, turning the tables, aren't we, Mary? As I mentioned, you usually host the cable show, and I'm on the other side of the camera. Mary usually keeps me in a back room somewhere hiding, working on the machines. But today she's letting me come sit in the big hot seat and interview her. So on today's program, we'll be talking about the impact of COVID-19 on individuals and families living with Alzheimer's and other dementias. But Mary, before we begin, can you tell the audience a little bit about yourself?
Absolutely, Lynn. And yes, this is certainly a turn of events for me being on this side, but I thank you so much for hosting the show today. And, this is such an important topic, Lynn. I have to tell you, obviously the pandemic has affected all of us. But this is an important topic right now. So I'm anxious to get into it. But, just so that people know a little bit about myself, I'm the Director of Professional and Community Education at Care Dimensions. I've been with the organization for the past 15 years, and my role is going out and doing education for professionals and for community groups. And we do a large number of programs every year for both groups. So this is something that, again, I have such a passion for. By profession, I'm a medical social worker, actually, for the past 35 years. So that's where my experience lies. I've done medical social work my whole career. Lynn, and I was thinking about this before the show. 35 years ago, when I graduated from grad school, I remember I had my first patient that I cared for who had Alzheimer's disease, and she was 39 years old. So this 35 years ago, we knew so little, and we still don't know enough, do we? But it was, I'll tell you, it's been an interesting 35 years. I've done throughout the years that I have been doing, medical social work. I've worked a lot with individuals and families who have a loved one with, or a loved one with Alzheimer's or related dementias. So, here we are. I've done this professionally, but I also just want to share with the audience that I'm here in another role today. That actually, I in addition to addressing the subject matter professionally, I also am dealing with this personally. My own mother has Alzheimer's disease, and I am her primary person, if you will. And I, even though she is getting care within a facility, I am there, and I am providing care and supporting her each day. So it's taken on a whole new meaning and role for me.
Well, thank you, Mary. And, the couple things hit me when you say that. The first is when your first ever patient was 39 years old. When I think of Alzheimer's and people getting, having an Alzheimer's or the dementia diagnosis, I think of older people. I don't think of a 39-year-old person. I don't think of a 40-year-old or a 50-year-old. So I think this information is going to be very impactful for people because the understanding isn't out there that this can hit any of us at any age. And the second, that you are going through this. I work with you every day, and it affects everybody's life. So I'm glad that you're sharing your story, not only your expertise, but your story with everybody. So thank you.
Yeah, thank you, Lynn. I think it's important to share this story. This is, this group of diseases, and I'm going to keep saying this throughout the program, this Alzheimer's and related dementia, right? Because there's other types. Even though Alzheimer's is the most prevalent type of dementia, 60 to 80% of all people have Alzheimer's disease, that form of dementia, but there's other types of dementia too. And as you were mentioning about this younger patient that I had, I'll tell you, back then, 35 years ago, we thought it was a disease that just affected younger people, that it was this rare disease. That's what we thought, that affected younger people like in their early 40s, because we used to write it off, right? People used to call it senility or hardening of the arteries. And we know so much different now that really it's a disease that primarily affects people who are older. Now, certainly there are people with younger onset, and we've done a show on younger onset, but the majority of people are older who get this disease. And but it has a huge impact. And just sharing the numbers with you, 5.8 million people in this country right now have been diagnosed. And that's just in this country. That's going to go up to around 14 million or so by 2050. So we can see the impact that this is having.
And the money and the research that I'm hoping is going into this disease, because it's taking a toll not only on the patients, but on the caregivers.
Oh, absolutely.
And I'm sure on the healthcare system too.
All of the above, Lynn. You're absolutely right. This is not just a personal issue. This is a societal issue. You hit it right on. And so we need to address this from all fronts. And there is a lot of research going in, and I applaud. There's some wonderful organizations, including, and I always want to do a shout out for the Alzheimer's Association and other groups that focus in, and there is a lot of research going on in this, and it needs to. But we also have to make sure that the individuals and the caregivers get the support, because these are unique diagnoses, these are unique situations, and it impacts the whole group, not just the individual, but the family too. This goes for a long period of time, Lynn, generally.
Yes.
And when they call this an endurance race, it's truly so.
And it's hard enough, Mary, during what we call normal times, but with the COVID-19 pandemic and how everyone's being impacted, how is the pandemic impacting individuals and families living with this, this disease?
Yeah.
Can you talk a little bit about, those ways?
Yeah, again, a really important question that you're asking. And I just want to say too, because you hit it again, is that we have to understand, we haven't lived through such a thing, right? A pandemic like this.
We haven't.
So it's, really, this is affecting everybody. How many things, like we might be going through certain things in our lives, or even, in certain groups and that sort of thing. How many times as a whole, the entire world is being impacted by this major pandemic, right? So this is affecting everybody. And certainly it affects people with Alzheimer's and related dementias very, very much. People with Alzheimer's and related dementia are by virtue of the disease process, they're vulnerable. It's a vulnerable group to start with. But this pandemic even enhances, it really exacerbates the vulnerability that they're experiencing. So, it can affect people in so many different ways. One of the ways too is that, remembering that people are in a high risk group. Now, the disease process, Alzheimer's unto itself does not put somebody at high risk, but there are things that do, as a virtue being the age. The majority of people with Alzheimer's disease are 65 and over. Right? And so by virtue of that, we know that 65 and over, those put people into a high risk group. The other issue too for people is that for people with Alzheimer's disease, generally, mostly they have what we call comorbidities or other health issues. It can be things like cardiovascular disease or diabetes or other things that they can have too. And that puts them at a higher risk because they have other health issues too that contribute to that. There are additional things that put people with Alzheimer's and related dementia at risk too during the pandemic because of the cognitive impairment. We know we know that we have to follow guidelines, right?
Mm-hmm. Lots of guidelines, yes.
Yeah, and we want to follow these. So we need to do things like keeping a social distance. We need to wear masks. We need to hand wash and sanitize and clean areas and do all of these things that are going to help. If we're going to sneeze or cough, we want to cover our nose, our face in those ways. People with Alzheimer's and related dementias, they can't do those things. See, so just by virtue of the behaviors, that can actually put them at a higher risk too. Even understanding that they need to do all this. Can they understand this? And then, 2 minutes later, are they and then you're telling them, put your mask on. And I'm sure it gets probably scary, frustrating. Oh, very much so. So, and again, great point. So it depends on where they're at in the disease process in terms of their level of understanding. Now, so let's look at that. I mean, first of all, so sometimes they can understand a little bit of it, but they do forget, right? So there needs to be constant reminders and all. So if they're in the earlier stages and they're living at home alone, how are they going to remember? Are they really going to remember to go in and wash their hands or do this and do that? Are they able to self-isolate? All of these things. How about even hearing about the news on this? How scary is that? Now, depending on where they're at again in this disease process, people are scared. And you know what? We as caregivers are scared, right? So our own anxiety about this, people with Alzheimer's and related dementia, even when they're further advanced, they might not be able to say it, but they can pick up on our anxiety, right? So when they pick up on our anxiety, what happens is that they have increased behaviors. Now, this is kind of a vicious circle, then, isn't it? Because they have increased behaviors, and then that causes us stress, right? And then our stress causes them to have increased behaviors. You see, this is a vicious circle that happens. So that's another issue with this. So as caregivers, and you know, that how do we manage our own stress so that we can help them too? It's really quite a challenge. So it's hard because we have to give reminders and trying to self-isolate. I know, and I'll give personal examples. You know, my own mother, my mother she's, you know, advanced in the process. And I can only see her really outside of a window right now. There are times that I can socially distance having a visit, but those are minimal. So I know she's trying to run to me, to hold me, to hug me. And again, that's not something we can do right now. So that's a huge challenge. And she doesn't have an understanding of why can't I hug her? Why, you know?
And even why she can't see you. I mean, there was months, these people that are in nursing homes. I mean, from March until just recently, have you been able to sit in at a deck across from her, and truly see her? And you know, like you said, you've been pretty lucky. You can see her through a window because she's on the first floor. But there's very many people that haven't even been able to do that.
That's right. Well, that's where again we need to have innovative ways, don't we? Like that's where you know, the FaceTime or the virtual chats, the things, you know, with staff helping. So there's different areas too. So if somebody has their loved one at home, there are a different set of challenges, right?
Sure.
Because now again, you know, you depend on. Listen, it truly does take a village to care for somebody with Alzheimer's or related dementia. So you need your support systems. Now, remembering too that people again at home, if the person has Alzheimer's, who's their primary caretaker? Well, generally it's it's a spouse. They're in a higher risk group as well. So there's that concern. They don't have the support networks, right? So that's hard too, is that, and then we're supposed to be apart from each other. So even like if the grown children are coming over, that sort of thing, the people are trying to keep a distance. So inherently having somebody at home, you've lost that type of support, even professional help. Let's say you get support. Let's say people even like go to an adult day program during the day. You know, a lot of those were not able having people in. So that didn't provide that kind of respite, or even having professional help at home, maybe aides or someone coming in. That has been cut back as well sometimes too, right? What if that person is sick, or what if they their own family members they're having to care for, their children? There's a lot of different issues that go on here.
So even with that, Mary, when you think of someone with Alzheimer's, is a routine important to them? So when this routine has been disrupted, does that cause more difficulty for caregivers as well as patients also?
I'm going to tell you, routine is at the center point. This is one major thing that we have to do with individuals with Alzheimer's and related dementia. We have to have structure. We have to have routine. They thrive on it, and we do too. Right? So it really is very helpful in terms of managing behaviors and other things, and just keeping them with a quality of life and happy in that way, right? Promoting well-being for them. So routine is critical. Now, routine has been totally dismantled, right?
For all of us, no,
yes.
Especially for them.
Oh. Yes. So think about it for yourself. It's aggravating, isn't it? It's overwhelming. It's, you know, we don't have that type of the routine or that type of thing, and it really is upsetting to us. They don't understand it. So now there's all this disruption. So we have to maintain routine, and in a lot of different areas. So whether it be the person's bedtimes, right? Getting up, and going to bed, they should be at the same time. We should try, and here's another area, exercise, physical activity. We all need it, right, Lynn? I mean,
I do.
right now, especially, one of the biggest things has been let's get out there. Like people are sitting down too much, right now. And we know that when we're active and we're moving around that, those endorphins are shooting out and our moods are elevated. Well, it's the same for people with Alzheimer's related dementia. Activity level is important, and people's activity level has been adjusted. It's been really cut back a lot. That's a problem. So these are things that we need to, and we don't want to overly stimulate people, but we certainly want to make sure that they have exercise and physical activity. um, so there's other things, even like eating well, right, and having regular meals at scheduled times, that sort of thing. Even like just the social connections. Now again, for the caregiver, let's talk about the home for a second. People in the home, again, they've lost their supports, so it's all falling on that person. We got to worry about the caregiver, right?
There's a lot of challenges that the caregivers are facing, not only the individuals with Alzheimer's or dementia, but
Yeah.
that the caregivers are facing.
Yeah, they need respite, Lynn. Caregivers need respite. And like I said, a lot of that has been pulled back during the pandemic. So we got to look at creative ways of how to do that. Social connections. Listen, let's also put it, there's a lot of grief around this. Now listen, and we could talk the whole time about grief, Lynn. I'm going to tell you that's how pronounced it is, right?
That
So,
might be another episode. We might have to make that
okay.
another episode.
Yeah, but it's just so there. Now let's even outside of a pandemic, the grief is so pronounced having a loved one with Alzheimer's and related dementia, right? And I always talk about it's called the ambiguous loss. When you lose the person mentally and socially, but physically they're right there. And I'll sit with my mother, who I just adore, as you know. And I look at her, and she's such a remarkable human being. But I've had to kind of form this relationship with this person. She's almost like a different person, but she looks just like my mother. But she doesn't act the same way or talk the same way or interact in any of the ways that I have been accustomed to for my entire life. So there's a grief associated with the loss that I have experienced in terms of how we have related and what we've done together. I think, so these social connections, even now let's bring COVID into it. So there's already the grief that happens because, as a family member, you're losing out on not just the what is, but the what will be, the what won't be, right? There's many levels of the loss there. With the pandemic, there's been huge loss. So like the social disconnect for people in the home setting, but for people in facilities, there's that disconnect as well. That you gotta be able to, you want to go in there. You're worried, like you're not, usually, and their family members might even be there around mealtime to help out, right? That's a major support to the facility too. And it's a time that people get to really engage with their loved one.
All that stopped, right? And that's not available anymore, right?
Well, and it is to varying degrees, but now here we are on an uptake again, right? We're on an uptick where cases are coming and they're higher again, and facilities are having to really, and they're doing, I really applaud them, Lynn. I have to tell you, doing a good job at making sure they're following strict guidelines around this, because people need to be safe. But it's, so as hard as it is, not being able to get in there. And as you mentioned earlier, I'll be standing outside my mother's window, and it's cold now. And sometimes I'm out there in the rain and in the rain and the thunder. Sometimes I've even been out there and she'll say, "Don't you want to come in?" I sure do. I sure do want to come in, but I can't come in right now.
No. And it is, like you said, the nursing homes are doing a great job, trying to keep everybody safe. So we respect that, and we totally understand that. But, I'm sure it's hard for caregivers. But what are some of the tips like you can give to caregivers to help with this, especially patients who are at home, but as well as maybe the, ones that have loved ones in facilities?
Yeah. Okay. And that's another show too, Lynn. Right? There's so many things that we could talk about with this. One of the things is, we got to follow the guidelines. Please really follow the CDC guidelines around hygiene practices, social distancing. Let me just say one comment about this. I am not a fan of the term social distancing. I'm just not, Lynn. I do. I follow the guidelines. I'm a stickler about it. We need to physically distance. We do. We need to be physically apart, but we don't need to socially disconnect. See, when we say the term socially distance, I feel that sometimes people take it literally and they feel like they totally disconnect and they cut off like any type of interaction from one another. Let's call it physical distancing and let's keep apart from one another to be safe. But please, let's maintain our social connection. So with that, I'll tell you, I have been able to do different types of things. So fortunately, I can call, and most of the time, my mother will somehow fumble around and lift the phone to answer it. It doesn't always happen, but it does most times. She doesn't know how to use it the other way, but it works this way. So I can have that connection. I'm outside the window, as you mentioned. Other times, like in a facility, people will get you on FaceTime, Skype, doing things like that. You know, visual chats to do things like that so that the person can see you. It's confusing. I'm going to tell you, it's very confusing when they do get me on FaceTime and my mother's looking and you can tell she's kind of shocked and doesn't expect to see me there. But she says the same thing each time, which is very sweet. So these are the things. These are our moments of grace, Lynn. Mm-hmm. And what she says is that, oh my gosh, you're so beautiful. You must be mine.
Oh, see?
and she says the same thing every time, which is so sweet. It's truly a mother's love and instinct never goes away, right?
No. And picture technology. I mean, I fumble with FaceTime. I fumble with, doing all that. Can you imagine now that, your mother who's in her 80s is figuring, with Alzheimer's can connect with you, and figure out, with a little bit of help, but figure out that she can still connect with you through that phone.
Yes. And fortunately, I have a wonderful staff on that end who's doing that with me. Yeah. So she wouldn't be able to negotiate that. But it's just great that we have these opportunities. So in terms of what you're asking around the caregivers, please make sure that there's the social connection in every way that you can make them using innovative ways. The other things too is the exercise, which I talked about, fresh air. Getting out. Listen, I know that the weather's getting colder, but fresh air is still important. So let's make sure that still, even if you're just outside, just in your little area, keeping safe, just outside the door, that sort of thing, you can do things like that. I talked about the consistency around mealtime and eating healthily. Getting sleep is another one, because see, this has caused sleep disturbance and appetite disturbance, right? So that has definitely been an issue. So we want to make sure that people can do that. Listening to music, even playing games that is within the reach of what the person can do. Those are some other things, just keeping people engaged in those ways. Hydration is really important. The other thing too is, don't alarm the person with Alzheimer's, right? Because again, even with my mother further along, and I don't give her a lot of information about this pandemic because she can't process it. So I give her just enough to explain, and I watch for her reactions. So if she has reactions to this, I really alter how I explain something to her. She can't conceptualize of what's going on. She doesn't understand why we're not able to be together. But we just give her enough information of how it works for her from her perspective. We got to reassure them that everything's going to be all right. She'll say, how long will this go on? She doesn't even know what this is. And I'll say, things are better. Because I can't, I don't want to, I say, I don't know. Right? Because what is the uncertainty? Isn't the uncertainty a big deal?
Oh, sure. Nobody likes uncertainty.
No.
And we talk about that all the time. What's coming down the pike? The cases are rising. The cases are going down. What's happening now? New guidelines have come out. We can't get into New York right now. It is a very challenging, scary time for people who can process, a little bit better too.
Absolutely. I truly believe, Lynn, that one of the hugest things for this is the level of uncertainty that in that word uncertainty, it falls on, so it's the uncertainty around our physical well-being or health, the uncertainty even around our mental, right, our mental health, right? People are so anxious, and some people are feeling depressed and anxious around, which how can you not, right? It's so overwhelming. So the uncertainty about, like, will we get sick, or will our families, or when will this be over? Will life go back to, I get this question a lot, when will life go back to normal? It's not a question that I can ever ask, right?
What is going to be and I think there's going to be a new normal, Mary.
I think you're right, Lynn. I do. I think that you're absolutely right, is that what is normal, first of all, but I think that this will, life as we knew it has changed. And not that things aren't going to get better again and all of that, but I do think, I agree with you. I think there'll be what we consider to be a new normal. And I think, but the uncertainty, I think, for everybody is just, again, what do we ever imagine it would go on this long?
No. Did we ever imagine something like this would ever hit us? And then, I think back in March, you and I were like, oh, well, we'll be back in a week or so.
Right.
8-9 months later. And there's no end in sight right now.
Absolutely.
So it's, and if you, like you said, the TV time, if you sit and watch TV nonstop, it can put you right over the edge listening to this.
Well, and that's another great recommendation, Lynn, for caregivers. Oh, please. And this stuff, again, we have a hard enough time conceptualizing it. People with Alzheimer's and related dementia can't. The last thing any of us should be doing is saturating ourselves, right, with news constantly. I know that we need to keep ourselves apprised of the situation, but we don't have to saturate from start of the day to the end. You take your moment during the day, not before you go to bed at night, right? Earlier in the day,
Yes.
So that you can, right? Because we have to worry about sleep here. Take your time and make sure, get your update. But again, you don't want to be constantly, because the anxiety, whether we're conscious of it or not, it gets to you.
Mm-hmm. And Mary, you brought up doing activities that, that patients can still, or individuals, loved ones can still partake in. And I just want to bring up, I hear you talk about the puzzles that your mom does. And you even work with her through the window and, help her get the frame done and help her get, when she mixes a couple puzzles up, you're helping her sort through them. So I love to hear those stories, because I think, you know what, you guys are keeping busy, and it's an activity that she loves and that she remembers. And that she can still do.
It's amazing, Lynn. You really can do a lot, even that's why, again, I said be innovative. And I do. I stand outside the window and we actually do the puzzle, and she gets a big kick out of it, because I'll actually have her keep moving her hand, and then I'll say stop, and I'll have her pick up the piece, and then I'll direct her to where to put it, and she gets the biggest kick out of it. The other thing that I did too was I put a bird feeder outside her window. I have to tell you, the joy she's gotten out of that, sometimes it's the small things in life, Lynn, and it's amazing the huge reaction you can get out of them.
Oh, well, Mary, we could keep going on, and I think this was a great show, and I think I was a great host. But
sure.
We're running out of time, but these were great tips, and really your expertise. And I do want to tell people that, you're a little modest with your background. You're well educated in dementia, Alzheimer's, and other dementia. And I just want everybody to know, even you have a certification from the National Council of Certified Dementia Practitioners, correct?
I do. And I've had the great opportunity of getting some certifications, postgraduate certifications, and getting some further on expertise in this field. So yes, thank you for mentioning it. So,
and thank you for sharing your expertise with us and with our audience. But we want to let everybody know that we always appreciate them tuning in, and that we look forward to being available to them again for our next topic. And I was going to throw a vote out there to see if they wanted you or I to host next, but I still think you're going to win.
Don't get too comfortable in the hosting. That's fine.
You're still our host. Don't you worry.
Thank you so much, Lynn. I appreciate you doing this today.
Well, thanks for having me. I appreciate that also, Mary.
home. More than ever, it's your sanctuary. But if you're caring for a loved one with advanced illness, it can feel isolating and worrisome. Care Dimensions can help. As Massachusetts' leading hospice provider, you can count on us for guidance, medical care, and support. We follow all COVID-19 safety precautions to protect you and your family, so you don't have to delay getting the care you need. Visit Care Dimensions online or give us a call.